Thanks for joining us here on 9 News Plus. I'm Chris Bianchi. Now, there's a concerning new fungal infection that is spreading rapidly through specifically U.S. healthcare facilities, and it also appears resistant to common treatments for most funguses as well. So it's also something we're going to get into here with 9 News health expert Dr. Payal Kohli. Dr. Kohli, I guess the first question I've got about this, what is it called, A, first of all, and B, what do we know about it at this point?
So, Chris, this is a fungus called Candida auris, and Candida is a kind of a classification of fungal infections, and auris is the Latin word for ear. And of course, it can cause an ear infection, but it can actually cause infection of many different organs. Now, this fungus has been around for some time, since about 2009, first discovered in the U.S. around 2016. But it's really the rapid increase in the last few months and few years that has us really worried. And as you pointed out, what we're especially concerned about is the fact that not only is it spreading so rapidly, particularly in healthcare facilities, to those that are most vulnerable, but it's also multi-drug resistant. And so normally the antibiotic treatments, or I should say, the antifungal treatments that we use to treat this are not working as well. So we're seeing resistance emerge, and that makes it much harder to treat, especially once the fungus goes from being just on the surface of your skin or something superficial to actually getting inside your body and being a more invasive infection.
Yeah, so how do you contract this? How do you get this fungus, so to speak?
The people that get it the most are the ones that can't sort of fight it off. So this fungus is ubiquitous. That means it's everywhere, but it's concentrated and probably found more in healthcare facilities, and we know that it's very hardy, so it lives on surfaces really well. I'm talking about like bed rails and bathroom knobs and floors and all the equipment that we see in healthcare facilities. So if you've got the fungus living in the healthcare facility, and then you put a patient in the room whose immune system is busy fighting something else, or it's immunocompromised because of their underlying disease, it can actually cause that fungus to sort of get inside their bloodstream and start to seed their organs and cause invasive fungal infections of their organs, which can, of course, be life-threatening. Now, the fungus can spread from people, so there are people that are walking around colonized with the fungus as well, which means if they're healthy, it's living on their skin. It's not a threat to them because their immune system can sort of keep it at bay, but they could be a vector or a vehicle to carry that fungus to somebody who is immunocompromised, whose immune system is not as robust, or somebody who has a catheter or a line or something else inside their body that's conduit from the outside world that the fungus could jump onto and then get into the bloodstream.
Is it visible? Would I be able to see it on my own skin?
No. So
Okay.
it's more like, if you think about the bacteria and organisms that live on our skin, most of them live in a symbiotic fashion with us. In other words, they just kind of live alongside us. Some of these more healthcare acquired pathogens can colonize us. In fact, there are other types of bacteria such as MRSA, methicillin-resistant Staph aureus, which is a very aggressive bacteria that the theory out there says that many healthcare workers are probably colonized with, meaning it lives in their nose, it lives on their skin. And so if they're taking care of somebody whose immune system is compromised, they could easily bring it to that person, even if it's not a threat to themselves. So it's hard to know. So this begs the question whether we should start doing more surveillance screening, especially of healthcare workers and those people that work in facilities where patients are institutionalized, where the fungus has a kind of environment to thrive in, where we should be checking them routinely to see whether or not they're colonized with this organism.
Are we moving towards that? Is that?
I hope so. I hope things like this are raising awareness of that, because at this point, the rapidity with which the cases are growing really does beg the question of what better can we do. And the problem is, the more cases we have, the more the fungus has a chance to replicate. Obviously, it's a threat to life, and can cause morbidity and mortality, but it can also create more antifungal resistance, because the more times that it infects people, the more times you're having to use the antifungals, the more the organism can evolve to start becoming resistant to the treatments that we have. So I think we need to start catching it upstream. We need to start catching it early when it's spreading, rather than having that reactive approach where we sort of wait for the infection to manifest and then try to treat it with our big guns, our antifungal, medicines that we have.
At this point, we're taping this on Tuesday, March the 28th of 2023. Roughly how many people have this? Or have contracted it, I guess.
You know, a few years ago it was in the hundreds. Now it's in the thousands. And so we have over 2,000 that have clinical cases, meaning they have some sort of clinical sequela of it. And we have over 5,000 that have tested positive on surveillance testing, meaning they might be colonized. So what we're seeing is a growth not just in the clinical infections, but in the colonizers as well, the people that are carrying it around and potentially are the vectors to spread it. So it's growing very quickly, and because of its drug resistance characteristics, because of the fact that it can cause pretty severe disease if it becomes invasive, the CDC has really raised the alarm on this kind of multi-drug resistant fungus, Candida auris.
Is this primarily a concern for those that are immunocompromised, or is this a health risk for the population at large?
You know, at this point, primarily those that are immunocompromised. So cancer patients, patients with HIV, patients with other chronic diseases, patients who are getting immunosuppression therapy for after organ transplant, or if they have lupus or rheumatoid arthritis, some other autoimmune condition, because their immune systems are shut off or they're distracted. And so they can't fight the fungus in the same way. For most healthy people, it's not a significant threat, because even if it lives on their skin or in their nose, like I mentioned, their immune system is sort of able to keep it at bay so that it doesn't get into the bloodstream and spread, you know. But again, the organism could evolve and its characteristics could change. And so that's why we really have to put our guard up, the fact that the cases are growing so rapidly.
Yeah. So what can we as a population do to avoid this?
You know, I think raising the alarm, particularly in healthcare facilities, and you know, making sure that we're doing a better job actually checking surveillance for colonization. We're doing a better job of cleaning in between patients, and that, you know, because things like bleach and UV light can actually eradicate this fungus from surfaces. So really using those sorts of measures to try to get rid of it. And then if you're a healthcare worker that works with immunocompromised patients, you should certainly get screened. Or if you're a person who has somebody in their family who might be immunocompromised or particularly susceptible to an invasive fungal infection because of, you know, their medications or chemo or what have you, then it's probably a good idea to get your whole family screened as well. The way to get screened is not necessarily straightforward. You have to get a specialized lab test to see, you know, if you're colonized with it or not. And then if you have the infection, they actually take your blood and try to see if they can grow yeast out of your blood. They can grow the fungus itself. But it's interesting how this came about, because that will teach us some stuff about how to fix it. And we're seeing this kind of large surge in the last couple of years, we think, because of COVID. Now, it sounds a little counterintuitive because you would think that we're better at cleaning things and better at hygiene. But think about all the crowding and all the overstretching of the hospital facilities that occurred, the lack of PPE, all of those things that occurred, especially in the early part of the pandemic. That really set up the right environment for these types of organisms to sort of take off and thrive. And now they've just become so common in some of these healthcare facilities.
Interesting, yes. That's something that did kind of cross my mind a little bit. That's a little unusual. How, from a broad perspective, are you worried about this, that it could continue to grow and continue to spread?
You know, I'm more worried about the immunocompromised. I think most healthy people will be fine, but I do think it's up to the healthy people. It behoves them to make sure they're practicing good hand hygiene, especially if they're going into facilities, and just sort of being cognizant if you have potentially been in a location where you may be exposed to Candida auris and you may be colonized with it, making sure that you take the right measures, especially with somebody who might be immunocompromised, keeping your distance from them, staying in a separate room, those types of things. So I'm not so worried about most people. I don't think this is going to be the Last of Us type of situation where this fungus is taking over humanity, and it's not going to be probably a COVID-19 pandemic sort of situation, but it has all the right characteristics, the recipe to become potentially something bad. So nipping it in the bud, really changing the trajectory of things now, I think is going to be very important.
Expand on this Last of Us thing. I watched the show. I'm sure a lot of you out there do as well. So this is not going to be the cordyceps fungus from the Last of Us, is it?
No, I don't think so. But it's interesting, The Last of Us, I mean, I haven't personally seen the show, so correct me if I say anything that's not correct, but they had acquired the fungus through contaminated food. Is that right?
I think that's how it happens.
Yeah, so that's usually not how we get fungal infections. So if you think about what happens when we eat contaminated food with contaminated fungus, you actually get sick from something called a mycotoxin, which is a toxin that comes from from the fungus itself. So it's almost like a food poisoning sort of situation. Unless you have compromised gut, in other words, you have some ulcerative colitis, you have Crohn's, or you have something else that causes the integrity of the mucosa inside your stomach and intestines to be compromised, or you're systemically immunocompromised. Eating some bad bacteria is not necessarily going to cause it to jump into your bloodstream that easily. And so similarly with the fungus, it's kind of rare to get foodborne fungal infections. It's more common to get it through the environment, through person-to-person transmission, through contact, through those types of things, because our eyes, our nose, our mouth, those are more common orifices for the fungus to get in than necessarily our stomach.
Okay, so that's a little sigh of relief for myself and a lot of you out there. Anything else we should know about this fungus?
No, I think what the fungus has really done is, for me, as a scientist, as a physician, it's alerted me that the effects of the COVID pandemic are going to manifest themselves on so many different diseases in so many different ways. And so I continue to stay humbled by what we've lived through and what we have lying ahead of us, because I think the last 3 years, the changes in our behavior, the changes in our science, the changes in all the things that have happened on a population level is really going to drive diseases to behave differently moving forward. And we as scientists and as the medical community have to really be prepared to pivot and to have our guard up, to pick up how the pandemic and the evolutionary impact it's had on diseases is going to impact things moving forward.
That's a super interesting takeaway. Just the different ways, not only in society, but also in the medical community, how COVID-19 is going to affect things now moving forward. But in the meantime, Dr. Payal Kohli, thanks so much for joining us, and also for reassuring us that The Last of Us is not going to manifest itself with this particular fungus. So thank you.